Uh, let Shekhar take a little time because he needs to prepare his body and mind for the Kriyas. Generally on Sunday morning, I also help. I also do the Kriyas, but because of the Zoom. Now, before I progress, let me answer a couple of questions what you have. First questions I've been hearing all the time. How many sun salutations should I do? How many times I will do? How many? You will be practicing. If you're with me yesterday evening, you have seen me. That it has to be called an effortless ease. What is an effortless ease means? You will be able to do all the asanas as if it is your sabasana. You will be able to do the asanas when, like us, we are talking, we are singing. I'm in a headstand, I'm talking. I'm in my Mayurasana, I'm talking. And your breath has to be normal. So now, how many sun salutation I want to do, Surya Namaskar? Keep doing it. 1, good. 2, fine. You still can talk. You still can breathe. 3, good. 4. Generally, we do sun salutation in a pair of 2. 2, 4, 6, 8. I also combine sun salutation with a moon salutation, Chandra Namaskar. Chandra Namaskar is a cooling. It takes out the heating poses from the sun salutation. Guess what? When you keep on doing sun salutation, there is no end of it. June 21st is the International Day of Yoga. We do 108 sun salutation, effortless. When you can do a faster sun salutation, we do 5 sun salutation in a minute. Linda is smiling because Linda has seen me doing it, you know. Yeah, Linda, say hi, you know. Have you seen me doing 5 sun salutation in a minute, huh? Yes or no?
Yes.
Yes, so. So it is not how many times, it is listening to your body. What is your body is going to allow you. And how do you know? As I said, no pain, effortless breathing, a comfort. It's called an effortless ease, a comfort of doing a yoga practice. And you keep on building up. You'll see, keep on doing. You know, you guys do all this intellectual discussion is great, but I'm a very simple person. You know what I do only? Only thing I do, called a Karo Yog, Raho Nirog. Linda and Kim, this is keep on doing yoga, you'll be disease-free, you'll be healthy. Okay, let's come talk a little bit about, let me close that window here. Backward light was distracting a little bit. This camera's webcam. Still out of focus. I'm still not in focus. Okay. Cameras have that mind. A yoga practice is a philosophy, it's a practice. As I said, philosophy is the Yoga Sutra of Patanjali, 196 sutras. Practice is Patanjali Ashtanga Yoga. And we have been doing it, learning it. Now, your practice to prepare your body and mind, yogis did called the Kriyas. There are 6 Kriyas called Shat Kriyas. The Kriyas are primarily called a Sharir Shuddhi. Sharir is a physical body. Shuddhi is a cleansing. You cleanse your physical body. Then you will know this practice of yoga has been infused with mudras, which we'll talk a little later after breakfast, bandhas, kriyas, Ayurvedic principle, philosophy and principle of Ayurveda, and it became what is called Yoga Chikitsa. That means yoga as a therapy. So if you go to a nice yoga center, especially in India, not here, you will see they've been using this Shat Kriya as a therapy. Anybody here went to Patanjali YogPeeth in Haridwar, Swami Ramdev's place? We've been there so many times. Indiraji was there, isn't it?
Yes, I've been there.
You've been there. So the whole section is called the Shat.
Yes, I was there so many times.
So remember the Shat Kriya, the whole building about the Shat Kriya, the therapy.
Haji, yes.
And very interesting thing is the whole in charge of Shat Kriya is a Western trained physician. He's a physician like me, and I met him so many times. So remember the 6 Kriyas? Tratak for your eyes, Nasya, Dhoti, a lot of dhotis. We'll talk about a little more dhoti. Kapalbhati, Nauli, Basti. One more time, if you're writing it down. Tratak, Nasya. Tratak is for your eyes, T-R-A-T-A-K. Nasya, N-A-S-Y-A, cleansing your nostril. Dhoti, D-H-O-U-T-I, dhoti, cleansing your inside, cleansing your stomach. Dhotis have about multiple dhotis. One is called a Vaman dhoti. Vaman is your throwing up, but it's not a throwing up. It's a primary, a profound relaxation response. It is called your Kunjal Kriya. Kunjal Kriya, Kunjal is an elephant. Like when elephant has a water comes out like a one big stream. Bastra dhoti. Bastra dhoti, you swallow a piece of cloth, it comes into your stomach, and slowly you pull it out, and it washes the whole stomach. It's a wonderful, relaxing practice. Danda dhoti. You will drink a lot of water. You will see, Shekhar is going to show it to you, Vaman dhoti. You'll be drinking keep on drinking water, little salty water. You'll feel the stomach is full. Put your finger in the soft palate, it'll come out. And it's not a retching, it's not a vomiting. Danda dhoti is when the stomach is full, you put a little bit of a tube and it comes out like a siphon. Danda dhoti. Nauli, he will show you the nauli. Nauli is just like sucking your stomach in, like your Uddiyani Bandh. Then you isolate the muscle in the middle, called the rectus muscle. You suck your stomach in, isolate, then move it side to side. We can all do it. Like Shekhar can do it. I can do it a little bit. Swami Ramdev does it all the time. If you can look into him, Nauli. Kapalbhati. Kapalbhati is a Kriya. And as a yoga practitioner and yoga teacher, the question always comes to you and me. Kapalbhati is a pranayama. So why the Kapalbhati is a Kriya? Kapalbhati is a cleansing practice. Kapalbhati done very slowly and effortlessly is a pranayama. Kapalbhati done very rapidly. Kapalbhati done as a cleansing procedure is a Kriya. So this confusion most of the yoga teacher has, they ask me all the time. So Kapalbhati done slowly Kapalbhati is called Agni Pradhan Pranayama. It ignites your Agni. It increases your Tejas. Kapalbhati means you have a bati, you have a glow around your forehead. That bati comes from your Tejas. And Basti is the enema. Basti is the enema, cleansing your colon. And yogic enemas are a lot different than the regular enemas. Now, what is the concept behind it? First concept behind it is I wake up in the morning, I wash my face, I brush my teeth, scrape my tongue, wash my face, wash my body, wash whole thing, take a shower. Why don't you wash the organ inside? The organ inside you wash. You can wash very easily your stomach, very accessible your stomach. You can very easily do your colon. Like enemas, if you know the Basti, if you know the yogic Basti, yogis have so much of control of their whole body system. They can even control their anal sphincter. They can sit down in the water, they can suck the water in, and they can let it go without even using any enema kits. I've seen it done. Wonderful practice. Okay, so if you have any question about a minute, you can ask, but I will let the Shekhar start doing it because he's ready. Shekhar, are you ready now?
Yeah, I'm ready.
I already explained to them the 6. Okay, the first about Nasya, you will see. The first he will do Jal Neti, and when he's doing Jal Neti, and then he will do Sutra Neti. And I'll be explaining to you and the procedure. You will be seeing him now in the screen. He will become, and I will be doing talking. So Amal, you go ahead and put Shekhar spotlight for all, and keep my microphone on.
Yeah.
So
can everybody see Shekharji's video?
Spotlight for all. You will be
Yes.
all.
Yes, you can see.
Okay, good. Thank you.
Good. So Tratak is for your eye. Generally, Tratak is done by lighting a candle. You put a candle in front of you and you keep on looking straight at the candle until you have, without blinking. What it does, the blinking is both voluntary and involuntary. I can close my eyes. If I don't do it, I'll be blinking. So blinking is a connector between your body and mind. It connects your conscious to the subconscious. We do it with the finger. So Shekhar is ready. Let's go ahead and first start with the Jal Neti. He will be preparing it. The first, he uses a pot. This is called a neti pot. I don't want him to talk. I'll be doing all the talking. I want him to do it. This neti pot, he is using a plastic, and we also have a porcelain. He puts the water in. This water is a little lukewarm water and has a little salt in it, which is called non-iodized salt. He will put it through his one nostril, and then what he's going to do, he is going to keep his mouth open. He will be breathing through his mouth and slowly turn the head on one side. Initially, when you start doing it, you see the water is not going to come out. It's purely a relaxation. More and more you get a relaxation, you'll see beautifully water will come out. For us, we do it every single day. Like brush our teeth, tongue. This is our called daily routine. So here he is, he's ready. He's putting it on his left nostril and he's opening his mouth. His eyes are closed and he's slowly turning his head. See how beautifully the water is coming out. Initially, it may not come out for you, but please don't get a concern. A lot of people ask me, where is this water is going? What the water will be doing it? And water cannot go anywhere, okay? Same thing he's going to do on the other side, the nostril.
Okay, is it close enough or do I need to get closer?
That is good enough, because if you come close, we'll be losing you, we are seeing you perfect. He's putting it in the right side. You can see the whole stream is coming out beautifully through his other nostril. It's a continuous stream comes out. And after that, he's going to blow both the nostril. And what he's going to do, I will let him do a little bit of a Kapalbhati Pranayama in different, because the reason for Kapalbhati Pranayama is you get a little bit of water in the sinuses. If you do a couple of them, it comes out. Now, everybody asks me the same question, yeah. And there is a sinus called a frontal sinus. Generally, the best way to do is sitting down. So if you cannot see me, you stand up, put your head down a little bit, and do some, because the sinuses, any water in the sinuses will come out. And this is called your frontal sinus. So that's what he was doing. So to drain the frontal sinus.
And
It is
also, Dilip bhai, see, sometimes your nose are blocked and it may not come out. So many times you can take it from the nose to the mouth. Okay, you suck it in through the mouth and you cleanse that way too. Okay, like. Especially when you are having cold, when you are having allergies, your noses are blocked and it's not easy to do the Jal Neti. So that's another way to do that.
another, so remember one thing, this is a purely a relaxation response. So what happens, we have a lot of yogis who will do completely opposite. What is the opposite doing? They will be putting it in the mouth, then it will come out through the nose.
All right, let's do it.
Let's do it. Put it in the mouth and come out through the nose, okay? So that's what he's going to show it to, because it's all relaxation practice.
Okay, I take the water in the mouth and push it through backward to come it through the nose. No?
See that? It's coming out from his mouth. Now it's coming out through his nostril. And what is that? It is totally a relaxation response and control over your reflexes. See, he's going to do it again, one more time, put it in the mouth, then he's going to bring it out through your nostril. All of you guys have seen it. So now what it means is that the yogis have a control. They do it even with the milk. They do it with the milk, and there are the two terms. One is you're called this is actually part of a Kapalbhati Pranayama. What is called the Krias? One is called a Bhutakram Kriya. It is like a Jal Neti, but you spit out, take the nose, throw in the mouth. And one is called a Shitakram. Shitakram is what he did, reverse, taking in the mouth, taking out through your nostril. So look at the terms. One is called a Bhutakram, one is called a Shitakram. Now, are you ready with your Sutra Neti?
Yeah.
Next one he's going to show you is called a Sutra Neti. Sutra Neti is generally done with a small red rubber catheter. Generally, this is available through most of the Ayurvedic centers, yogic centers. If not, you'll find a called 12 French red rubber catheter. Initially, you may need to lubricate a little bit, but for us, we really don't need anything. You can put it in a little water and just take a look at him. He would slowly put it through his one nostril. So now he's using little oil. Just putting little oil in the lubricating it, put through one nostril, slowly will come out through the mouth, and literally he will be doing the flossing of his nose. What it is, a control over your reflexes. See, normally, nobody will be able to do it because the moment you bring something to your nostril, you will have a sneezing. You are going to have see how beautiful it is going in, and it's going to come out through his mouth. And he gets it to the mouth and pulls it out, and you'll see. Okay, See this gag reflex? This gag reflex will be so strong for other people, you won't be able to even touch it. So what it is doing is basically that he now is coming out. You see that both of them, one through the nostril, one through the mouth. Okay. If you can come little bit in front of your laptop, I know it's hard for you to move, but that's okay. Yeah, sit it down. Okay, take a look at it, how beautiful it is. It is through one nostril and coming out through the mouth. Okay, beautiful. And generally is done also through the second. So what it is a voluntary control over involuntary function. And that's the way you develop control over your autonomic nervous system. So people say, how can you control autonomic nervous system? These are the practices we do. So he've been doing it for so long, I've been doing it so long, still we get this sensation. We get this sensation, but this sensation slowly and slowly will go away. And then you could also put a little oil, remember, little oil in the nostril. What it does, so he's going to try in the other side now. He's going to put
this catheter is very thin, and problem with that is, especially in the throat, it goes in the back of the throat, and it's hard to catch that. You know, I've
solved this problem, Shekhar. I think I will give it to you. I have some extra, or you can order it. Amazon.com. 12 French red rubber catheter. Write it down. If you want to write it down, 12 French red rubber catheter. It does perfect Sutra Neti.
Yeah. The last time I ordered through Amazon, they just had this kind. And yes, it's better to have a, this is just
specify 12 French red rubber catheter instead of Sutra Neti. Sutra Neti will come like this, and these are also little flimsy. Sometimes you get coil, sometimes even get coils inside, you know.
Yeah, that's
so
right.
You need a little bit of a stiffness. Okay, he's going to show it again now. He's very close. Take a look at it now. It's a wonderful practice when you start doing it. Good thing we're doing it before breakfast, isn't it? See how it came out beautifully? To the nose, it came out through his mouth. So you do the dental flossing, he's doing flossing of his nostril. Okay, how beautiful it is. Wonderful practice. But you know, it initially takes out a lot from your body and mind. So generally after this, we'll want him to take a little bit of a rest, and which he will do it. So Jal Neti and Sutra Neti. For us,
so
if you did yes.
Somebody can I ask a question, Dr. Sarkar?
Sure, go ahead.
Yeah, so is there anything while doing either Sutra Neti or Jal Neti, is there anything that we should watch for, which is like a red signal, maybe not proceed ahead and back off?
Yeah, most of the red signal is your systemic symptoms. When you get the whole flushing of the face, you get all the watering in your eyes, and the body is telling you that you are really violating your body's function, you back off. But do it again. See, more and more you're going to do, you're going to overcome these reflexes. And this takes a little time. For us, it's not an issue anymore because we do it daily. We do it daily, you know, doing a tongue scraping, Jal Neti, and this is, and also remember, all these things we're doing, you need a little oil in your nostril. When you put a little oil in the nostril doesn't rise up. So what we do before going to bed, we take, you know, it looks a little gross practice, but it is a little finger, dip into the oil, put inside our nostril. We put a whole oil in the nostril and do it. So he's going to show it to you how to put a oil in the nostril and what it does.
Almond oil.
Almond oil.
Almond oil for use in nostril. So
Dr. Sarkar. Dr.
Boliye,
Sarkar, I have question. Like you said that standing we can do Jal Neti, Sutra Neti, and everything we can do standing.
Okay, you can generally, you like to do it sitting down like this, what he's doing,
Yeah.
therapeutic purposes.
Yeah.
But if you are pushed, like you are in a bathroom, you have to do it. Yes, initially it's no problem doing it in a standing up on your sink in the bathroom.
Okay.
That's what we do actually, because see what he's doing. He's taking his little finger and putting the little finger all the way in and massaging the nostril. And if you do it before you go to bed, you will have a no sleep apnea. You will sleep right away. You know why? You sleep through your nostril, because at night what happens, your nose gets dried up, nose gets blocked. You breathe through your mouth, and you breathe through your mouth, it wakes you up. It's called a sleep apnea. And again, I'm saying I'm from Bengal. In Bengal, we have a very Bengali beautiful term. It's called nake tel diye ghumai. You sleep with the oil in your nostril. Okay, next one he's going to show is a Vamandhoti. Vamandhoti is washing your stomach. What he's going to do, he has this water. You generally prefer little lukewarm water or little bit of a salt, non-agar salt, and he'll keep on drinking it. Generally, he drinks about 6 glasses, 4 to 6 glasses, and he feels in his stomach when his stomach is filling up. And he's doing it very slowly and one gulp at a time. These are wonderful yogic practices. Now, all of you have seen these comments here, how good Shekhar is doing, how good we are doing all these practices. You know why we can do it? Because we do this thing also. So he's drinking. Let me see how to do moon salutation. Okay, very good. Shekhar ji, I have received the shloka PDF. Okay, I will take a look at the messages. I will answer, but here, watch it the way he's drinking. Initially, even if you drink and try to do Vamandhoti, nothing will come out. You know why? Because this is a purely a relaxation response. If you're not relaxed, nothing will come out. In fact, most of the Western trained physicians says this creates a retching and it causes some bleeding from your esophagus. There's a term called Mallory-Weiss syndrome. Mallory-Weiss syndrome is a bleeding from your esophagus. But here, what he's doing, first of all, is sitting in a malasana. The malasana is purely relaxed. So he drank enough. He feels his stomach is full. Now he is going to bend. Okay, look at this. He is going to touch the soft palate and the water will come out. Take a look at it now. So the water comes out and comes out without any retching. Look at that. Now he doesn't have to even put his finger in. This is called Kunjal Kriya. Kunjal is an elephant. That's why elephant water comes out.
So this in the beginning you can do with your fingers, but
later you don't need.
You need it after the experience, like I can do now with my contracting of the ab muscle.
Notice one thing, in a normal vomiting, this is not going to happen. Normal vomiting will be retching, notion. This is purely a Kunjal Kriya. Purely the water is coming out completely effortlessly. This is the control over your reflexes, voluntary control over involuntary function, controlling your autonomic nervous system. By the time you can do it, you will be able to do your Chakradan, Shankhadan, Sarpadan. It is a part of preparing your body, see? But this takes a little bit of out from you. And generally what we want him to take the rest of
the mucus and the acid and the heavy things staying in your stomach, they all come out.
And
Gonna
and
have
it's
a
very
yeah, go
and
ahead.
it's very good for even sometimes, it's good for your all the stomach ailments, no, but it's good for your neuropsychiatric disorders. Let me tell you why. If any of you have a very severe migraine headache, have you ever noticed that when you get a migraine headache, you throw up, you vomit, and the headache is gone? We recommend this for migraine headache. We recommend, see, for all the nausea, all the Sutra Neti, we do for chronic sinus infection, allergies. This is for your all kinds of stomach, hyperacidity you have, gallbladder problem, pancreas problem, stomach problem. Believe me or not, this will go away right away. And this generally follows with what is called a Basra Dhoti. Basra Dhoti also, it takes a little time.
Sarkar sir, we're doing this clean water,
Yes.
and with the clean water for the woman dhoti.
Yes.
No salt
So-
in the water when you drank the 6 glasses had no salt, just water?
Yes, this is the clean water, and initially, if you put a little salt in, it's okay. But here, he's doing it for so long, he can just do it with a regular water. It's just a feeling. You have to have a feeling. That's what he's feeling. His stomach is filling up. And then, when it comes out, remember one thing: the esophagus, stomach, there's a sphincter called esophageal sphincter. He can relax the sphincter. So see, watch it now, how he's going to come out. He doesn't even touch. He's contracting his stomach, is coming out. For a normal people, it's not going to come out because that sphincter is going to close it. Initially, the water, and essentially you will see when it keeps on doing it, a bile will start come out. A greenish fluid will come out. When the greenish fluid comes out, that's a bile. That tells you that your stomach is completely washed. And you do it in the first thing in the morning without any food in your stomach.
So this way, if you ever happen to eat something or drink something which is not good, some poisonous food or something, you can vomit it out also.
I can always share this thing with all of you. And Shekhar knows about it very well. Me and Shekhar were in Trinidad. We were doing a teacher's training. So they asked us to eat some street food. So we ate the street food, me and Shekhar. I was fine, nothing happened. Next day, Shekhar had a serious stomach issue. He said, what should I do? I said, Shekhar, so do your Vaman Dhoti. So he went to the bathroom, he did the Vaman Dhoti, boom. I mean, he can tell you, instantly he got better. So, this is our own personal experience. And next, if you have seen now, do you have anything else? You don't know the Basra Dhoti? Okay.
Yeah, just showing that I'm not going to do too much.
Okay, that's good.
Last workshop we did it.
Yeah. Just show it to how to just swallow it. That's it,
Yeah. So
okay, look at this is called a Basra Dhoti, and you swallow a piece of cloth, and then it goes all the way in. Generally, it's about almost 20 feet.
Yeah.
It's a long one. It's a long one. It goes all the way down. Then he slowly pulls it out. He's soaking it now. If any of you go to Patanjali YogPeeth in India, you will be doing all this stuff. So nothing is be surprising when you go over there, especially any courses you take. Then there is a whole center, the therapy through your.
You basically chew the cloth, swallowing it, like swallowing it.
You're noticing it, how he's swallowing it, literally chewing and swallowing it, and it is going to go all the way down to his stomach. When you start demonstrating this, a lot of people get say, "Oh, I don't want to see it." They want to just get out. But when you start doing it, everybody comes. Watch it now. And he's pulling it out now. Beautiful. Generally, when it comes out, it will come out like with a bile color. There's a greenish color because bile is the residual of your stomach.
Yeah, because we did the Vaman Dhoti first, and I did
Exactly.
not go deep into the stomach.
That's okay.
Just showed people, they have heard about it. At least they know. Once you see somebody demonstrating it, you don't have that fear in you.
Yeah. So what is the time now? You go for a breakfast. Shekhar, you take a little rest now. Yeah. If you have any questions, I'll be glad to answer now. And I will, Amal, you can take him out from a spotlight view. And if you can put me on a spotlight, and I will answer a couple of questions what I have here. Let me read the questions here. What do you have? Yeah, I think Shekhar is like Baba Ramdev ji. Yes, you keep on doing this, and you'll be same as. Okay, Super Pranayama, Namaste. Shekhar ji, I have not received the slokas. How to do moon salutation? Chandra Namaskar. Okay, you guys want to see a Chandra Namaskar?
Yeah, I have one question. Question.
Go ahead.
Like Kunjal, we can do anytime, right? Like in the morning, but you can do every day, Kunjal?
Kunjal Kriya generally we don't do every day, Okay. Kunjal Kriya, no. Jal Neti, Sutra Neti, those things we do. Kunjal Kriya is actually, these are your, we can do once a week, once a month. A couple of people that does it daily, but you really don't need to do it. And then another comes Shankha Prakshalan. Shankha Prakshalan is another, cleansing, which you cleanse through all of them. And there is not a hard and fast rule. Your body will be telling you. Like for him, he's doing it for so long, it's not really, nothing is bothers you. But you will build up slowly.
Dr. Sarkar also want to indicate, like after you do Vaman Dhoti, you wait 20-30 minutes before you consume anything.
Any food. And also, for him, that's what I'm telling him. After doing a Vaman Dhoti and Vastra Dhoti, I'll take him to lay down, a little bit of it like a Savasana or relaxing. And then you don't consume any food. So you keep practicing, we'll say, Dr. Sarkar, can you please say Chandra number?
You said 12, you said
what?
12 French red rubber.
12 French red rubber catheter.
Catheter, how do you spell that? Catheter.
C-A-T-H-E-T-E-R. Catheter generally they use for your, like passing urine, like urinary bladder. When you go to the, if you have any problem passing water, it's called a catheter, red rubber catheter.
Okay, how do you spell that?
Yeah, it's there in the last message. If you see that, it's there.
C-A-T-H-E-T-E-R. 12 French, yeah, Amal wrote it down, 12 French red rubber catheter. Okay, what happens someone has a deviated nasal septum? Absolutely nothing. Deviated nasal septum has nothing to do with your Jal Neti and Sutra Neti. We have been talking about it. We talk to the ENT people. It is all in your relaxation response. When happen, you don't get the relaxation response. You said, oh yes, I have a deviated septum. It comes through my mouth. It comes through over there. So now if you watch it, Shekhar, he's in the smaller view now. He is laying down. He's laying down. So nothing bothers you. What it bothers you, actually, it's preparing your body and mind. It's purely a mental, like we call a software controlling your hardware.
Oh, yeah. We learned, actually, we learned Dr. Sarkar when I was in 11th grade. I went to the Dhirendra Brahmachari.
All right. So you know.
And we did all of this, but we didn't continue. So, but I can do Kunjal, I can do Jal Neti, but Sutra Neti I have to try again. I didn't do.
Remember one thing, always remember, I can do it, I used to do it, I will do it, has no meaning. It is your own personal practice. You do it, you don't have to even talk to anybody.
Yeah.
You know, generally the practices we do in our bathroom. It is purely our personal practice. Even my family doesn't know even, you know, I have all these things, or I have all these things in my bathroom. It's my section. And I do it every day. That is the practice. Now, this is actually 9:37 almost. You go ahead and take a little break for your breakfast. Come back again at your, what will be your 10 o'clock. 10 o'clock, I'll start a session on the mudras, acupressure, and your Ayurveda. Now, Amal, I need to talk to you a little bit. If you want to, okay?
Yes, yes.
Okay. This afternoon, if you look at a session, there is a session called graduation. Okay,
Yes, 4:15. Yes.
Yeah, let me stop recording.